Hey everyone, welcome back to my channel. Before we get started today, I just wanted to make a little note that I am going to be changing the name of my channel. It was brought to my attention that apparently there are multiple other channels with the same name, and I just want to avoid confusion. So probably by next video, I will have a new channel name. So just be on the lookout for that. Today's video is going to expand on a topic we kind of talked about last video. So if you haven't checked that out, you should go and do that. It was, what is it like growing up with a blind parent? And I had both of my children in that video, and we very briefly talked about my son's condition. My son has a heart condition. It's called ALCAPA, and I wanted to make a longer video about that because, like blindness, unless you're in that sort of situation, you kind of really don't know about it. I had no idea that there were so many heart defects out there, first of all, and let alone that my newborn could have one. It just didn't dawn on me when I was pregnant, especially because most of my testing came back, clear. So there was no real indication that there was something wrong. So let's get started on this. I have my iPad here just to kind of reference. I had a blog that was ongoing at the time during my son's hospitalization. So I went back and I reread the blog and just kind of pulled out some points that I really wanted to discuss. So if you see me looking down, it's my iPad. I'm just kind of, making sure I'm not forgetting anything that I really wanted to discuss. So this all started in February of 2012. My son was born January 1st, 2012. He was the New Year's baby in our city, first baby born, and he was absolutely like an angel. He was quiet, he slept a lot, he ate very well. My daughter was the absolute opposite when she was born. She was very colicky, she was very fussy, she had a very hard time keeping food down. She had bad acid reflux, and she also had really severe ear infections. So we felt like we were kind of being rewarded for dealing with such a tough infancy with my daughter. So when we had my son, we were just ecstatic. We never really thought of it as being an issue, to be honest, but that should have kind of been our first red flag, was that he was sleeping so much. So in February, both kids got sick. We live in New England. The weather gets really, really cold, and despite trying to keep the house clean and germ-free, both kids got sick somehow, and I brought the kids to the doctors just to kind of be safe, because my son was so young and because my daughter had her history of ear infections. So we went to the pediatrician. His name was Dr. Daner, and he actually seemed really concerned with Addison. He kind of brushed off Charles as, it's just a cold, you're being a young mom, you're being concerned, it's fine, he'll be good. But Addison, he really wanted to make sure that she didn't have any more ear infections, so he focused most of his attention during the visit to her. So fast forward about a week or two later, Addison got better, but Charles sounded much worse. I took Charles back to the pediatrician, and at this time, Dr. Daner admitted Charles to our local hospital. He was admitted overnight, and we stayed in the lumbar unit, where they just kept doing albuterol treatments every 4 hours and keeping an eye on him to make sure that everything was okay. By the morning, we were discharged. We were given a nebulizer so we could continue the albuterol treatments at home, but we were also given a follow-up appointment for the following week. The following week, Dr. Daner was on vacation, so we saw the on-call pediatrician, Dr. Frias. Dr. Frias saw Charles, and she noticed that his stomach was retracting when he breathed, which means his stomach was pulling very far in, and then he would, push it far out. It was an indication that he was having trouble breathing. They did an albuterol treatment in the office, and when he wasn't sounding any better, they admitted us to the hospital again. Again, we were in the hospital overnight, but this time Charles was kept under an oxygen tent. He was administered oral prednisone, which is a steroid, and he was given the albuterol treatments again. By the morning, he sounded much better. The prednisone had kind of cleared him up. The albuterol wasn't doing anything, but they continued the treatments. But I feel like the prednisone was definitely what helped. So they continued giving they continued the prescription for the oral pred at home, and we continued the albuterol treatments at home. Now, at this point, I had switched pediatricians from Dr. Dana to Dr. Frias because I felt like she handled my son's condition a little better, rather than just telling me that I was being irrational. I was just being a young new mom, and I shouldn't worry. I really appreciated how Dr. Frias handled the situation, so I switched to her. And after a couple of days at home, Charles had stopped eating. There was one night where he just ate nothing. I remember laying in bed and being awoken by him shrieking. Like, I had never heard a baby cry this way. And I pulled him up because he was actually vomiting laying on his back. And it was the scariest moment at that point. That morning, it was really early morning. That morning, I had called the pediatrician, again, the on-call PD, because it was actually Saturday. It was St. Patrick's Day. So that day I called, made an appointment. They actually told me just to take him straight to the emergency room. So I went back to our local hospital, and he was seen again, and they wanted to admit him a third time. And at this point, I had told his pediatrician, I do not want him seen at this hospital. There is a children's hospital located roughly an hour away from where we were living. I requested that we were transferred to that children's hospital in Boston. And that day, we were taken by ambulance from our local hospital to Children's Hospital. And that was probably one of the scariest rides I've ever had in my life. I remember being harnessed into the ambulance and just flying down the highway. It was raining. It was really just scary. But we got to the hospital and we were seen extremely quickly. It was like a half hour. There was a doctor in our room. They said, let's take an x-ray of his chest, see what's going on. So, we were sent for an x-ray. X-ray comes back. They said, his heart looks a little enlarged in the x-ray, so we're going to do an EKG. Okay, so they did an EKG, and at that point, they said, some of the results came back a little wonky. We're going to repeat the EKG. The results indicated a rare heart defect, but it's so rare that we're not even going to consider it right now. So they repeated the EKG and got the same results. So at that point, they decided that they wanted to do an echocardiogram or an ECG, which is basically like an ultrasound of the heart. I don't know what Alexa's doing. Listening into my video, apparently. So, at this point, they decided to do the ECG, and I am waiting in the room, watching, and my husband at that point, my children's father, will just refer to him as TJ in this video. I don't want to use his real name I just don't want to put it out there. So at this point, they ask, where's TJ? And I say, oh, he just went to go move the car. He had parts on the street and he is moving it to the garage. They said, okay, well, when he comes back, we'd like to speak to you both. And I just felt my heart drop to my stomach. And I said, you can talk to me right now, and then I'll just relay the information to him. And they were like, no, we really need to speak to the both of you. So at that point, I knew something was wrong. I did not expect the heart defect still, but I knew something was wrong. And I remember TJ walking in, and he didn't even get into the room. They had literally pulled me out, and I was worried about leaving Charles alone. And they said, don't worry about him. He's in good hands. We're going to finish up the ECG. We just want to talk to you guys. So they bring us to this little tiny room. And I mean, this room was like a closet, and it had a small table and 4 chairs. So we sit down, and there's a woman and a nurse, the doctor, and they say to us, well, we discovered that what we thought, was impossible is actually what's going on. Charles has a rare heart defect, the one that we mentioned, and he's going to need open heart surgery. So at that point, I was like, okay, when? Thinking like in 2 or 3 months, we'll prepare ourselves, we'll come back, he'll have his surgery, he'll be there for like a week, and then we'll come home. And they were like, well, today's Saturday, he needs it Monday. And I just felt like I can't even explain it. I couldn't even believe, that my world just kind of got like literally turned upside down in 2 seconds. And I was like, how am I going to make this all work? I had literally just started a medical assistant program the week before Charles was hospitalized. So I had to call them up and cancel that, let them know what was going on. I had a million things going through my head, but the biggest thing was, is my son gonna be okay? They informed us that if he didn't have this surgery, the fatality rate was roughly 93%, that he wouldn't make it to his first birthday. It's very, very rare that children who have ALCAPA that are left untreated will survive. I've seen in the ALCAPA group that I have joined on Facebook, I've seen a handful of ALCAPA babies who have made it to adulthood without their condition being treated. But once it's discovered, it's immediately repaired, because it's just not something that you should let go untreated. It definitely increases your risk of fatality. And as a matter of fact, I found out that quite a few cases of ALCAPA are misdiagnosed as sudden infant death syndrome because it's just not caught in time. So to continue on, we had that conversation with the doctor, and I want to say she was a social worker. I honestly don't remember who the other woman was. But I remember walking out of the room and just breaking down and just losing it, and calling up our family members and saying, hey, we're going to be here for months. Charles doesn't have whooping cough like we initially thought. Charles has a heart condition, and he's going to need open heart surgery on Monday. So immediately they took us from the emergency room and they brought us to the cardiac ICU unit. If I remember correctly, I want to say it's on the 7th floor in Boston Children's. I honestly feel like it's the 7th floor, but I could be wrong. So we go on up, and we're in this big kind of like, I want to say it's like a glass box is what it feels like, with just a little like bassinet type, bed and machines all around. And as soon as we get into the room, we just literally had a team of people barraging into our room, introducing themselves. Hi, I'm going to be your son's anesthesiologist. I'm going to be your son's surgeon. I'm going to be your son's ICU nurse. And they were asking us questions, and we just felt so stunned. Like, it was hard to answer them because I just couldn't wrap my mind around what was going on. It was such a shock. So eventually, we settle in as best as you can, really. And they started Charlie on Lasix, which is a diuretic. They noticed that his heart rate was pretty high. It was in the 180s. So they wanted to make sure that he was doing okay. They wanted to try and reduce the amount of stress on his heart as much as possible in the next couple of days leading up to surgery. Let's see if I'm forgetting anything. How did I get this far into the video without actually explaining to you guys what ALCAPA is? So ALCAPA is called anomalous left coronary artery from pulmonary artery. So ideally what it is the left coronary artery is attached to the pulmonary artery rather than the aorta. I apologize. My accent is definitely coming out and it's not cute. So the left coronary artery is attached to the pulmonary artery, which the pulmonary artery brings deoxygenated blood, brings blood to the lungs. And instead the aorta, the valve that brings blood to the heart. I'm sorry, I butchered my notes there. So the left coronary artery is connected to the wrong sort of area. It's connected to the pulmonary artery rather than being connected to the aorta. The pulmonary artery brings blood to the lungs. The aorta brings blood to the heart. That made it so much easier rather than trying to decipher my notes. I apologize. So he was getting very little oxygen to his heart. His heart was weakening, and part of his heart was actually dying. When he was admitted to Children's Hospital, he was actually in heart failure. The only treatment for ALCAPA is open heart surgery. What they do is they take that coronary artery and they move it to the aorta and repair the pulmonary artery. I think that there are other methods of repair as well that, depending on which surgeon is completing the surgery, they might use a different technique, and it might impact the recovery time after surgery. And I was told this by our surgeon. I was told that the type of technique that he's doing during Charles's surgery should ideally give him the shortest recovery time, in which he absolutely did recover really quickly. Compared to a lot of ALCAPA kids, honestly, my son is extremely lucky. So let's get further into this video. The survival rate we went over. I went over that we were moved to the cardiac ICU, and at that night was pretty uneventful. That night I slept at the hospital in the ICU room with my son, and TJ had slept at his father's house. His father lived roughly a half hour away from the hospital, so rather than drive the whole hour back to our hometown, he just drove to his dad's and stayed there so that he could come back and visit the next day. The next day, We met with the anesthesiologist and the surgeon, again, by themselves, though. It was a little more one-on-one. We were able to ask any questions that we had. Apparently there is a fruit fly down here. I was able to ask any questions that I had, and it was a lot less stressful than when we first met them on Saturday, the night before. So that Sunday, we were kind of just preparing for Charles to go into surgery the next morning. He was put on Lasix, which I said, why is this one? So he was put on Lasix. That Sunday night, TJ and I slept in the parenting quarters of Children's Hospital. So when your child is in the ICU, you are given a room in the parent sleep quarters. And this parent sleep quarters is like off of where the like sleep study area of the hospital is. It's a very quiet area, but you have to walk quite some way to get there. It's very creepy. It's very Resident Hill type, Resident Evil, Silent Hill type stuff when you're walking through at night to go there, and it's just silent, and the lights maybe are flickering, and yeah, it was very creepy. Oh, and not to mention, Boston Children's had these like autonomous robot things that just would roam the hospital. They would bring trays to rooms. It was so freaky. And there were clowns that would roam the hospital and sing, and they would sometimes just sit in the elevator and sing to everybody that got on. It was really a stressful time during my life. So anyway, that night we slept in the parenting sleep quarters. The bed was tiny. It was smaller than a twin size bed, and TJ and I both slept on this bed. Barely slept because we knew in the morning our son was going for surgery, and roughly around like 5 a.m. we came back up to the cardiac ICU, and my dad was actually there, which was a relief because originally he wasn't supposed to be there. He was going to go to work, but he explained that like he really just felt like he couldn't work the day while I was in the hospital with my son getting open heart surgery. Like he felt like he had to be there for me. So I was unbelievably excited to have my dad there for me. He's always been one of the absolute biggest people in my life. Him and my aunts have basically raised me. So, I felt really supported at that time. We also had other family members who decided to come up. So we had a lot of support that day. His surgery began. So at 1 p.m. they took Charles. They rolled him into the operating room. TJ and I were allowed to go down to the hallway where they took him. And I remember leaning over and giving Charles a kiss, and he was so hungry because he wasn't allowed to eat that he was like trying to eat my face. And it was just something, I started crying and I was laughing, and it just made me happy because he was just so funny. Like, he's still a really funny kid, but even as a baby, he was hilarious. I'm hoping I get to edit this video and add in some pictures just so you guys can see some of the pictures I'm talking about. Especially like later in our hospital stay, he, throughout this whole thing, was just so funny and upbeat. Like, he was so upbeat. So at 1 p.m. they took him. It took them an hour and a half to prep him for surgery. His surgery started at 2:30. the nurse took my cell phone number and she gave us a call I want to say it was like every half hour to an hour that they would call and give us an update. So they would let us know Charles is now on ECMO, which is like a lung heart bypass machine that basically does his breathing for him, and it, you know, works as his heart while they're trying to repair his heart. So we sat in the family waiting room pretty much all day. We tried to keep ourselves entertained as best as we could. We were trying to watch TV. I started my blog. We told jokes. You know, we just tried to keep the mood light. We tried to really keep ourselves from being depressed, thinking about everything that could go wrong. And eventually, it was around like 7 that they had called us and they said, come on up, you know, TJ and I to come on up, that we would be able to meet with a surgeon and see Charles. So we went up to the surgery center, waited over an hour. Nobody came out. We got another call that said, go back to the family room. The surgeon's going to meet you down there. So we were so nervous, rushed back down to the family room. And finally we meet with the surgeon, and his first words out of his mouth was, your baby is okay. And I just lost it. Those 4 words it was just like I can't even explain it to you guys how unbelievably lucky I feel to even just hear that. Especially after such a long surgery, I just felt like hearing that he was okay and that he wasn't in, like, you know, there weren't any hiccups, there wasn't anything, you know, unsuspected. Although we had found out the day before that while the surgeon was reviewing Charlie's scans, he found 2 holes in Charles's heart that we were unaware of as well. So they repaired the holes in his heart while they were repairing the ALCAPA. And he said everything is great. There's even mild improved heart function already. You know, he is not on the lung heart bypass machine now, which is something that we thought he was going to be on. Post-op, they let us know that his chest was closed. Again, we thought post-op his chest would have to stay open in case they required, you know, anything additional, rather than having to reopen his chest if they left it, you know, open. It wouldn't be as traumatic, I suppose. And they said that, you know, he was already just doing great considering what he had just gone through. And honestly, in that moment, I just felt like I felt like I was on every drug probably known to man. Like, it was, nothing could bring me down. The hardest part was over, I felt. We were past surgery. We were already making a little bit of progress, and I felt like we were ahead of the game. They told us, why don't you guys go eat? We're gonna finish up doing what we're doing, get him settled, and then you guys can see him. So at that point, it was very late. We all walked over to a food court that was about a block away, and we all tried to eat, and I just remembered being so excited and so, like, over the moon that I couldn't even eat. I don't think I even ate that whole day. And I just remember, like, waiting and wanting to go see him, and waiting. And then we finally went back, and they brought TJ and I to the room where Charles was. And I remember walking in, and just seeing him covered in wires. He had IUVs everywhere, and there were machines just behind him that were hooked up to IVs, and it was crazy. It was unexpected. Despite the fact that the day before they had brought us to the room of a little girl who was post cardiac surgery, it was still heartbreaking to see that little girl. But to see your own child like that, it was even more heartbreaking. I apologize, my daughter's phone is going off. So it was just really hard, although I felt like, again, the worst is over. He made it through. It wasn't as heartbreaking for me to see him in the position he was in, but TJ broke down the second he saw him. Up until this point, I felt like it really impacted, everything was impacting me so severely, but TJ seemed really like nonchalant with it, like it didn't bother him really, like up until we got to see him for the first time post-op, and that's when he really started breaking down. He actually ended up leaving the room and letting somebody else come in to peek on Charles and make sure, you know, just to kind of see him. So we gave our family members a little turn to go in and just say hi to Charles. We didn't want too many people obviously going in there because he had just had surgery, just literally came out of surgery. So, you know, everyone maybe had 2 minutes to peek in, just kind of say their, you know, their piece and walk out. And then everyone helped me bring all my stuff to the parent sleep quarters. I slept down in the parent sleep quarters, and TJ went home to our house. That night, I ended up speaking to my mom and dad on the phone. So I didn't go to bed till pretty late. And it was roughly an hour later, I got a phone call from Charlie's room. One of the nurses was changing the balloon attached to one of the tubes that Charles had coming out, and it sprayed her in the face. So she had been sprayed in the face with some bloody fluid from Charles, and they needed my permission to test for, I guess, diseases, transmittable diseases. And I obviously said yes. I guess during his surgery, he had received blood transfusions, which I was unaware of at the time. I mean, it makes sense, obviously, but it just didn't dawn on me. I think I was still young. I was just a lot going on. I was very ignorant to the situation. So at that point, I decided, like, I wanted to donate blood, you know, as sort of like a way to give thanks to whoever donated the blood for my son. So I believe it was the next day I ended up going and donating at the blood donation center in Boston Children's, and I had never donated blood up until that point, in which, you guys, if you haven't, go do it. Honestly, go to your local blood shelter, your blood center, and donate, because it's really not as bad as you think it is, and it helps so many people, and you never know if your blood type is one that is needed. So definitely go out and do that. The big thing that I was pushing to people who would come visit is, if you guys go donate blood, you guys get free parking, because Boston Children's would give free parking passes to people who donated. So, I mean, if that's not incentive enough, just go and do it. Do it for Charlie. Anyway, so day 2 of post-op, rather. let's see. Day 2, so obviously he came out of surgery. They put him on a paralytic. He was on a lot of heavy drugs for pain, sedation, all of that. So they had put him on a paralytic, and the following morning they decided to lift the paralytic to try and like see how he would do on his own. So I was obviously very excited at first. I wanted him to do as well as he could. And I was really disheartened when they had to put him back on the paralytic that same day because his heart rate started climbing, his temperature started climbing, but his blood pressure was dropping. And they felt like this was kind of just stress. It was too much for him to breathe on his own or to even just be awake, because he really wasn't breathing on his own. He had a ventilator, but for him to be conscious in that time, it was just too much for his little body. And I felt really disheartened at that point because I really just wanted to see him awake. I wanted to see my son the way that he was normally, and I couldn't. And I spoke to the nurse, and she, told me, just be patient. You got to be patient with him. He's going through so much that I couldn't even comprehend, honestly. And he deserved that rest. So I tried very hard to like keep that in mind throughout this whole recovery journey. As much as I wanted things to be back to normal, as much as I wanted to hold my son, as much as I wanted to see his eyes and hear him cry, I had to be patient for him because he was recovering from something major. So it was a big learning process. Patience was never really one of my strong suits to begin with before children. Not to say that I was impatient with my children. I just am somebody who has a hard time waiting. I'm one of those people who, as soon as I buy a Christmas gift for somebody, I want to give it to somebody. So patience was hard for me to learn, and I have learned it somewhat over the years, especially from this whole situation. It has definitely taught me to be more patient with myself, with my children, with strangers, just in life. So at this point, they had put him on a cooling blanket to try and bring his temperature back down. And once he was back on the paralytic, he kind of stabilized and was doing a lot better. Now that night into the following morning, Charles had some issue with the lines where his medication were, and they were actually attached to an IV in his jugular. One of the lines had become, I guess, kinked, which really threw off his meds, which ended up throwing off his blood pressure and temperature and all of that again. And so they weren't able to take him off the paralytic the next day either. To avoid that same situation happening again where the line became kinked, they decided to move all the medications to the line that was connected directly to his chest, to hopefully keep that from happening again. Let's see. At this point, his temperature wouldn't come down, and when they were suctioning his lungs from being on the ventilator, they were suctioning up a lot of like yellowy junk, and so they assumed that he had an infection at this point, and which again wasn't something I had considered this whole time. Yeah, Charles made it through surgery. Great, the hardest part is over. I didn't think, what happens if he gets a post-op infection? They had told me before surgery that the odds of post-op infections were pretty slim. So when this happened, I was scared shitless. Excuse my language, but honestly, I felt like he just went through this major surgery. This kid can't catch a break. He ends up with an infection. Like, what are the odds? So the next day, his temp came down a little because they had started him on antibiotics and Tylenol. His temp came down, his blood pressure stabilized, and they were trying to wean him off some of the medications he was on. They were weaning him off the dopamine, but they were increasing the epinephrine that he was on because the epinephrine was helping his heart contract. They also stopped, I guess, heparin that he was on, and they wanted to try and lift the paralytic again. So this is day 3 post-op that they were trying to lift the paralytic. He started moving a little bit, but I believe his heart rate went up too high. It was his heart rate or his blood pressure ended up spiking, and they felt like it wasn't good for him. He was getting too excited, too aggravated, and they honestly thought that maybe it was him fighting the ventilator because he was initiating some of the breaths he was taking on his own. You can watch the monitor on the ventilator and see what the machine is doing versus what Charles himself was breathing, and they felt like maybe he was competing against the ventilator a little bit, but he wasn't at a place where he could probably breathe on his own full time. So they gave him a drip, a shot of the paralytic rather than the drip, to see if by the time the paralytic wore off, if perhaps he would be a little more calm and able to be conscious, but not so aggravated, not so flustered where his heart rate and everything else was elevated. He was also on methadone and Ativan at this time, and they were slowly weaning him down on those. Those two drugs are very powerful. They can result in fatal withdrawals. So they were being extremely careful, especially with the Ativan. They didn't want him to have any sort of sign of withdrawal. So again, very powerful drugs this little boy was on right after the surgery. In addition, he was on insulin because we decided to participate in a clinical study that the hospital I'm sorry, my fibro brain, that the hospital was, going through. It was something regarding the effects of insulin on infants who have cardiac surgery. I guess they had done the study with adults who had had cardiac surgery and found that giving insulin post-op would decrease the amount of time in the hospital and increase the speed of recovery time. I guess the sugar levels spike after surgery, and so they give insulin to counteract that. Don't quote me, I am not 100% sure. It has been quite some time since I looked over the paperwork for that study, but I know that we had to discontinue participating because the line that they were pulling, the IV that they were pulling the blood samples from to test his sugar levels for that study became unstable at some point, and they didn't want to risk it simply for the study. So we ended up having to withdraw from that study. I wish I could find out, honestly, the results, because that would be quite interesting. Now, the next day, his heart rate dropped overnight. He was doing good. Everything seemed normal. Again, initiating breaths on his own on the ventilator, and they had completely stopped the dopamine, and they ended up increasing the methadone because they had stopped the paralytic. They wanted him to have some sort of, I guess, like sedation effect, which the methadone gave, and methadone is actually a really good drug for cardiac. So they increased the methadone just a little, but they ended up decreasing the Ativan, stopped the paralytic completely, and at that point he was initiating breaths on the ventilator. Day 4 post-op was the first time that Charles opened his eyes. It was the first time I remember getting a video, and if I can insert that video here, honestly I will, but if not, again, it's in the blog, which is going to be in the description below. I remember taking the video on my really crappy flip phone and just being so excited to see his eyes. And I was talking to him, but he couldn't find my voice in the room. His eyes just kept darting everywhere. And it was really brief. He ended up closing his eyes again and falling back asleep, which I was okay with. It was just nice to see him open his eyes for that brief moment, because it had been so long. So throughout all that time, you know, he had been coming off of things. I saw his incision for the first time post-op. It was 1 week post-op, and I remember leaving the room. They had pulled the gauze off to kind of clean it, and I had never seen it at that point. But the first time I saw it, I had to leave because it was just, it was more than what I was expecting, to be honest. I mean, I understood they had just cut into my son's chest, but I don't know. It was hard. It was really difficult. Day 8 post-op, he had spiked another fever. This was kind of like a routine throughout his whole stay in the hospital. He would spike a fever, it would come back down. He would spike a fever, it would come back down. We weren't sure what was going on because he was actually on antibiotics this whole time, so why his fever kept going up and down was beyond us. He had been extubated on day 9, so he was no longer on the ventilator. He was breathing on his own. They would still suction some stuff out of his lungs, but what they had us do was they gave us this little like anesthesia mask. It was a baby anesthesia mask, and I would put it in my palm, and I would just cut the back on his back, and it would like loosen all that phlegm that was in his lungs, and he would cough it out. This is something that they taught me to do, you know, to help loosen up all that junk that was in his chest from being on the ventilator. After he was moved off the ventilator, within 24 hours, we were moved to a step-down unit. And once we were in the step-down unit, we were no longer by ourselves. We were in a shared room, which was kind of unfortunate at sometimes because during this whole experience, I was having a lot of issues with sleep. I was having a lot of issues with eating. Obviously, this kind of all hit me in a really tough way. I was seeing a counselor at Brigham and women, but I was still having a lot of trouble. And so having a whole other family on the side of us with another baby who was crying and waking us up, it was really difficult. And at that point, I just couldn't wait to go home. it wasn't long after this point that we ended up leaving, because Charles was just doing so wonderful with his feeds. They told us one of the most difficult parts of our hospital stay was going to be Charles relearning how to eat. And so his first bottle he didn't do that well. He had a feeding tube that went through his nose just so that they could give him medication and it wouldn't deter him from bottle feeding, but he still did really lousy the first time he bottle fed. It seemed like, and I don't want to brag, but it seemed like every time that I fed him, he ate no problem. He would eat 6 ounces. It wouldn't throw up. He was perfect. But every time the nurse tried to feed him, she had difficulty. He would only eat 2 ounces, or he would eat, 4 ounces and throw it up on her. For some reason, we called it the magic touch. So not only did Charles have to relearn how to eat before we were discharged, he also had to be completely weaned off the Ativan before we were able to be discharged. They were okay with sending us home on methadone, but they were not okay with sending us home on Ativan, and I was totally okay with that. I was really nervous about even giving him the methadone, which he ended up having withdrawals from once we got home. And seeing your 4-month-old have withdrawals from methadone is a whole other experience in itself. I felt kind of helpless. It wasn't the same helpless as when I was in the hospital. When he was in the hospital, I at least had doctors, I had monitors, I had reassurance. When we were home and he was just inconsolable and I didn't know what to do, I felt helpless. I felt powerless. So once he was past the methadone, it was a lot easier, honestly. Charles never gave me trouble about taking his medication. In fact, he used to cry because he wanted more of his medicine, but he couldn't have more. So he was really good about that. And even as a toddler, he was really good about eating. He was really good about, there weren't any severe developmental delays that were caused by his surgery. Before we were discharged the day before Easter. Literally 3 weeks we were there, and we had to meet with the heart transplant team before we left. We also had to meet with the neurodevelopmental team at Boston Children's, and it's because they anticipated that Charles was going to be developmentally delayed in the future due to the fact that he had a major surgery before the age of 1. He was a little delayed with walking. I think he was maybe 15 months, but maybe 15 months by the time he started walking like by himself, no problem. But everything else he was really on par with. So I feel like that's everything that I kind of need to know, that I kind of need to share as far as like the hospital stay of ALCAPA and the story that I went through there. I'm just trying to read through it real quick and make sure there's nothing else that I wanted to add. There were a lot of things that changed our life, obviously, but at this point I had gone on Facebook. I had found an ALCAPA group. I had found other families who had been afflicted with the same condition and found that their stories were identical to ours, and it made me feel sadly comforted, to know that I wasn't alone, to know that there was hope, that Charlie was going to be okay. And just to have somebody there to ask questions if I ever had anything. And over the years, I honestly have taken joy in being that person for other women, other families who are in the same situation. The ALCAPA group, from when I joined to now, has grown, which is both a good and a bad thing. Some of it is people who were diagnosed later in life. Some of it is people who didn't find the group until later. Some of it are people who sadly lost their children to ALCAPA. But we all feel like a family, and we all can understand exactly what the other person went through. And honestly, it's something that if I didn't have that support, I don't know where I would be. I don't know how I would have handled the situation, because a lot of people would ask me, how can you remain so strong with everything going on? And I did not feel strong in that situation in the least. Trust me. I felt so unbelievably like weak. Just, I can't even explain it. But now Charles is 9.5. He is going into the 4th grade. It's gonna be exciting. When I think back to where he was and I see where he is now, there are times where I forget that he had a heart condition, that he went through all this, just the way that I forget that I'm blind sometimes, because it's been our normal and it's been what we have dealt with our whole life. It's just something our family, is used to. It's not until people notice that Charles has a scar. It's not until people ask me about my tattoos that I remember, oh, other people aren't aware of this condition. Other people aren't aware that this can happen to them. And like I said in my last video, you can't let that stop you from having children. If you are worried about having children because of the possibility of a heart defect, or because of the possibility that your child could be blind, please don't let that hold you back, because your child could be perfectly fine, perfectly normal, and you're missing out. And even if your child does have a condition, who cares? It's part of life. It makes them, who they are. Just as I probably wouldn't be the same woman I am today if I am not blind, my son wouldn't be the same person he is today if he didn't have his heart condition. So if you guys have any other questions about ALCAPA, or if you, have any suggestions for future videos, please let me know in the comments below. Please like, subscribe, share, all of that good stuff. I'm trying to get my channel to grow a little. I'm trying to stay away from just doing blindness videos. So I'm thinking about doing a true crime video in the future. I'm still deciding on which specific case I'd like to do. I don't want to do something that, is oversaturated, that everybody has a video about. But I also want to do something that is interesting, and is going to keep you guys engaged. So feel free to leave some suggestions or send it to my email, babblingbrooke017@gmail.com. Other than that, thank you guys so much and have a wonderful day.